Good afternoon. My name is Congressman Mark Takano, and I represent the people of Riverside, Moreno Valley, Jurupa Valley, and Paris in the United States House of Representatives. I'm speaking to you tonight about a very important subject, the coronavirus pandemic that has spread across the world and struck the United States. And like many of you, I've been working from home for the last several weeks, staying in touch with local health officials and reaching out to my constituents to stay informed on the progression of the disease in our community. Since the coronavirus crisis began, Congress has passed 3 bills to help address this difficult situation. The first bill was an $8 billion bill authored by House Democrats that provided funds to purchase emergency medical supplies and to make coronavirus testing free for every American. The second was a House bill that provided $100 billion to help workers, families, and small businesses that are struggling with the economic effects of the pandemic. And last month, I traveled back to D.C. to help pass the third bill, a $2.2 trillion emergency stimulus package that included funds to support small businesses, to expand benefits to unemployed Americans, and to send checks of up to $1,200 per adult and $500 per child to households across our nation. As we speak tonight, Democratic leaders in the House are negotiating with the Senate and White House on a fourth package because it is becoming clear that the cost of this pandemic and lives and damage to our economy will only continue to grow for the foreseeable future. Tonight, I will answer your questions about the government response to the pandemic. I will also be joined by Claudia Moreno, the Southern California Outreach Manager for the Small Business Majority, who can help answer questions about the impact of the situation on our local businesses, and Dr. Alfredo Ratniewski, the Executive Chief Medical Officer for Borrego Health, who can answer questions about the virus itself. If you would like to ask a question, please press 0 on your phone at any time, and you will be placed into our question queue. We will have many people on the call tonight, and we may not get to every question. If we do not reach you by the end of the call, you will be given the chance to record your question, and it will be forwarded to a member of my staff. We also have questions that have been emailed into us over the past few weeks that we will provide answers to. Before we begin, I'd like to give Ms. Moreno and Dr. Ratniewski a moment to introduce themselves. I want to thank you both for joining us tonight. Ms. Moreno, why don't you begin by introducing yourself?
Thank you, Congressman Takano. My name is Claudia Moreno, and I work with Small Business Majority. And really briefly of what we do, we are a national nonprofit, and the way our model works is research, education, and policy. So we just launched a research polling on Monday to best understand the small business and where they are right now with COVID-19 and how they're getting impacted. And then we do a lot of education right now where we're doing a lot of webinars, both in English and Spanish, on what EIDL, PPP, and other funding resources that are available for small businesses. And then thirdly, we do a lot of policy advocacy. So we are talking with a lot of small business owners from across the country to best understand how these programs are being rolled out so that we can provide feedback to our elected officials as well for these programs that are being in place. So that's what we do in a nutshell, and happy to answer questions as they come along.
Thank you, Ms. Moreno. And I just want to emphasize that the term PPP means Paycheck Protection Program. Many of our listeners may not be familiar with some of the shorthand acronyms we throw around, but the Paycheck Protection Program is the program that small businesses can get loans for and also then have those loans turned into grants if they keep their employees on the payroll. We'll be talking more about that tonight, I'm sure. Please press 0. Press 0 if you have a question. And I want to now turn to Dr. Ratniewski to introduce himself.
Thank you very much, Congressman Takano, for inviting me to be here. Indeed, my name is Alfredo Ratniewski, and I'm the Executive Chief Medical Officer for Borrego Health, which is a federally qualified health center that we have 26 clinics operating mainly in Riverside County, San Bernardino County, and San Diego County. I will be more than happy to answer any questions that the audience might have regarding the clinical implications, the medical implications of the coronavirus. And just want to let you know that we are in the front line taking care of people that come with a problem, with symptoms suggesting the disease, and it's been a tough time for all of us, including the patients, the medical facilities, etc. But we're in there giving a good fight and turning this around in order to defeat this problem. I want to tell you that if at the end of this of the time that we have here, you have questions or doubts regarding the disease, we at Borrego Health have a coronavirus triage hotline. The phone number is 760-477-0802, and there you can get your questions answered and be directed to a clinic as deemed necessary. Thank you, and looking forward to your questions.
Thank you, Dr. Ratniewski. Bienvenidos and gracias for your being here. Press 0 to ask a question. And we have our first question from Betty Cooley of Riverside, and she has a question about college students. Betty, go ahead. It's going to take a couple. Betty, are you there? Do you need to unmute your phone, or is Betty ready to go in the queue? Betty, go ahead, and if you're on the line, go ahead and speak to us. You may pose your question. Why don't we? It looks like it was disconnected. We want to move on to Steve from Riverside, who has a question about the $1,200 checks. Go ahead, Steve. Steve has a question about the $1,200 checks, and I guess we got this question online. He's not actually in the queue to ask the question in person. So, as I know that checks are arriving as we speak. Some people have received their checks already. They are going out in waves, and if you filed a tax return last year in 2019. And you fit the criteria, the IRS is already automatically sending these checks to you. There's nothing that you have to do. If you filed, and if we didn't file one for last year, they were looking at your 2018 returns. If you didn't file a tax return at all, because your income was, below the amount that would trigger a tax return, or you are a Social Security recipient or on SSID, or you are a recipient of veterans benefits and your benefits are not taxable and you typically don't file a tax return, you may go to the IRS website, irs.gov/coronavirus, and it will take you to a page where you may fill out a simple form. You do not have to file a tax return. You just fill out a form and you answer that form, and it will take you a little longer to get your return because they do have to go through this process. But if you already have a Social Security number and you've been filing taxes, you should be getting a check so long as you fit the criteria of not earning over $75,000. And if you earn over it, your benefit is reduced and is capped out, I believe, at $115,000. But you should be receiving a benefit if you earn $75,000 or less of a $1,200 check. So I hope that's helpful to you, Steve. Now we have on the line Tom from Riverside. And Tom, you have a small business question. Go ahead, Tom.
Yes, latest news reports indicate small businesses and local banks cannot get through the system to get the benefits going to the small businesses. How can that be overcome? They say that the system is overloaded with requests. The banks can't get through, nor can the small business people.
Thank you, Tom, for your question. Why don't you hang around? Go ahead, Ms. Moreno. Why don't you take a crack at answering this question?
Thank you. Yes, so we are hearing that we first tell small business owners to go to their business bank where they have their account open, but there are also other the SBA has also approved other lenders like FinTech, for example, as well, that are providing opening applications for the PPP program, the Payroll Protection Program. Where can you find them? You can visit our website at smallbusinessmajority.org, where we are verifying all the other lenders that you don't need to have an account with them, or you don't need to open an account with them, but you can submit your application. So there are other options for you, and I'm more than happy to guide you as well. And you can visit our websites for that.
So that website is Small Business Majority or businessmajority.org?
Smallbusinessmajority.org.
Smallbusinessmajority.org, and you can get some assistance through your organization with this issue of finding financial institutions that are participating in the SBA program. Brenda from Moreno Valley, you have a question about face masks. Go ahead, Brenda.
Yes, I did. I just wanted to know, there's so many people running around here still without masks on. I'm in one of those high-risk categories, and I'm 63 years old, and so is my husband, and it frightens me. I want to know the proper way of telling people, where are your darn masks, How do you get through to them in a respected manner,
Thank you, Brenda. This is a concern. My understanding is that the way that the sheriff and law enforcement are relating to this matter is that it is strongly encouraged guidance from our county health officer. He did put out a directive. Law enforcement does not appear to be citing people for not wearing masks. They are highly encouraged, and you see signs in front of frequently visited places like our gas stations, our supermarkets, with signs stating that people must wear masks. I think, my best advice is to, politely say to people that, it is important that we wear masks. But all I can say is on this line to all the listeners that it is very important that we do follow these guidelines. And there is ultimately a $1,000 fine. I suppose if there is persistent and willful ignoring of the county ordinance, that it will be enforced at some point. I see that the state of New York is imposing this requirement on all of its citizens, and that more and more jurisdictions are adopting what Riverside County I fully support Riverside County's decision and Dr. Kaiser's decision to issue this. But I can tell you at this particular moment that, law enforcement is being very, let's say, they're being somewhat cautious in enforcing. But I think there's also a phone number I think that you can call to report concerns about people wearing face masks. If you'll be in touch with my office, we'll make sure we get that number to you. There is a county office that's separate from a police number or a sheriff's number. If you do call the police, they can refer you to the county as well, to where you can make the complaint. And I know that's not a satisfactory answer. I feel for you that other people are either negligent or willful, but I can tell you that it does seem to be that a great number of people in our area are complying and are wearing a face covering. If you want to ask a question, please press 0. Please press 0. And we now have Mark, who has a question or a comment about small business loans. Go ahead, Mark.
Hi. I was a little confused with the EIDL disaster loan, whether it only made sense if we had certain kinds of debt, or that we have to sort of show that we've paid back or paid off, or if it was sort of a more general blanket kind of loan, if that makes sense.
Yeah, Mark, why don't you hang out and the call monitors, make sure that Mark is able to kind of maybe interact a little more with Ms. Moreno. But Ms. Moreno, Claudia, can you first of all explain what EIDL means to most of our folks, what that acronym means, and what it is Mark is asking about, and maybe we can get down to some of the confusion that Mark, we can resolve some of the confusion Mark has about the program.
Yes, definitely. So it's a lot of information. So we have the Emergency Injury Disaster Loan, known as the EIDL program, where you can apply through the SBA.gov. That is the only space that you can apply for this loan. And this loan comes at, you can cap up to $2 million. You can get upfront up to $10,000 of money upfront, depending how many employees you have. So, for example, if you have 5 employees, you can only get $5,000 upfront. This is a loan where it's up to 30 years, and it's 3.75 interest rate. So that's one. That's the Economic Injury Disaster Loan. Then the second one is the Paycheck Protection Program that was mentioned earlier, where you have to go through your bank, where you have your bank account, business bank account set up, or there's other lenders as well that I mentioned that are also getting approved by the SBA to provide this PPP program. This Paycheck Protection Program is capped at $10 million. And the purpose of the PPP program is to maintain your payroll and maintain your employees and not, let them go. So how this plays out is, you qualify for this program, you use this money to keep your employees on your payroll, and you can get a certain amount forgiven. And this loan or this program is 1% of an interest rate, and you have 2 years to pay this off for whatever amount you did not use for payroll or certain utilities and rents, certain expenses. And there is no collateral or personal guarantee as well. So those are the two biggest differences between both of these programs. So the question for you, or the answer for you, is what we're telling everyone is apply for both of them. Apply for both of them. Obviously, the thing that we're trying to avoid is to not double dip. So do not use the funds for the same, for payroll that you get for one loan over the other. So I'll stop there. I don't know if Congressman Takano, if you want to add anything else.
So you're advising them to apply for both programs, but he had a question about whether he had already had debt or that. I mean, do you have any thoughts about what his question is? Are you still on the line, Mark? Apparently not. But he had questions about already having some debt and whether or not he should apply for this loan.
Yes. So this, if you have some other loan or debt into place, this will not impact the situation that you're in. So still apply to both of them, and that other debt or other loan. And the biggest thing is that if you were denied by, if let's say like a year ago you applied for a loan and got denied, don't let that be a reason of like, oh, they denied me in the past, they're going to deny me for both of these loans. These two programs that Congress passed, it is very unique for this COVID-19 situation. And as I mentioned, for both of them, there is no collateral, there is no requirement to have been in business for a year. It is a very loose, there's not much requirement, so that's why we're telling them apply, and don't let, debt that you have in the past be a reason for you not to hesitate to not apply to this.
Okay. Thank you, Ms. Moreno. Joyce from Moreno Valley has a question for Dr. Ratniewski on testing. Go ahead, Joyce.
Oh, actually, my name is Bruce, and the question
Bruce.
that I was asking was about the testing of which would be more important to test to find out the people that have already had the virus, to see if they have the antibodies to it, or to test people that just to see if people have the virus. Which would be more important?
Okay. Thank you for the question. Go ahead, doctor.
Well, as you well know, we've been having problems not having enough testing to do the testing to as many people as we can nationwide. But the most important test in order to control this pandemic at long term would be the antibody test. And when the antibody test can tell us if you had the virus or if you have it, or if you had an old infection that you're already immune to the virus, or if you have a recent infection having the virus. So that is very important in order to control the pandemia long term, because that way you know who's safe to go to the streets and not get infected, etc. However, short term, in order to see who can be still contagious, is the test that they do with the swab in the throat. The thing that worries us a little bit is that this has been a work in progress regarding our learning process on how does this virus behave. Now we're finding out that people that had the virus tested positive with a swab, then they stayed at home in isolation for 2 weeks. And then they come out and we retest them, they can still have the virus. So they may be over the disease, they might be immune, but they can still be contagious. So again, I think that nowadays both tests are important, but the one with the antibody is just about to be available in order to complement the one that we currently do with the swab in the throat.
So, doctor, you're saying that both testing for people who have it and to find out if they have it, and testing people who already have it, that both are important, but right now testing capacity means that we have to emphasize to verify that people do have it. And as we do get the capacity to have the antibody test available on a wide and mass basis, that's going to be important in terms of maybe getting some people to be able to go back to work.
Exactly. So the financial implications are those that we will be able to send back to work people that would be immune to the disease and that will not be contagious, which is the ideal situation.
Well, and what do you know about the impending availability of the antibody test? You're saying it's about to be ready. What do you know about? What can you tell us about that?
Well, what I can tell you is that that test should be available within days. It might be 7, it might be 10 days, and the CDC might object some things that might be perfect, that might be amenable to make them even better and more accurate. But what they need to make sure is that there's not a good amount of false positives or false negatives. Meaning making sure that when a test with the antibodies, you need to make sure if it shows you that you're immune, that you're indeed immune, and if it shows you that you're not immune, that's the fact that you're not immune. That's what needs to be perfection, as opposed to the test with the throat swab, where it's more definite. Either you have it or you don't have it. There, the amount of false positives or false negatives is a lot less by nature.
Well, thank you for that. Before I get to Joel Robles of Moreno Valley, I want to give a number out following, I think it was Brenda from Moreno Valley. She expressed frustration about people not wearing masks still. And Brenda, you can call 951-351-6866. That's 951-351-6866, and that's the reporting hotline for Riverside County Public Health. And I'll be giving that number out again at some point, but that's where you can report frustrations with other citizens not wearing masks or unsafe situations. Joel Robles of Moreno Valley, you have a question or a statement about stay-at-home order.
Yeah, I was just wondering how much longer you anticipate the stay-at-home order to take place, and maybe if there's any studies regarding like apartments, ventilation or something like that, maybe shared apartments. Is there anything about virus able to get through the ventilation of apartments?
Oh, whether virus can travel through the air conditioning ducts and the central heating and air conditioning, and maybe even the plumbing system. Is that kind of what you're asking?
Like yes.
Okay. All right. Doctor, do you have anything to say about that?
Yes, indeed. Let me tell you that this has been such an ever-changing situation that if you recall at the beginning, we used to say, well, don't worry about the virus because it will stay only for an hour or 2 or 3 hours in inanimated objects. And then it turned out that the virus can stay alive for up to 1 or 2 days in carton or even in plastic surfaces or metal surfaces. So it's been changing. Before we used to say, well, this is not an airborne disease because even though you get it through someone too close to you that might spit or might blow in your face or whatnot, now we know that the virus can even stay in the air for longer periods of time. So even though we're not sure if a virus can travel through the ducts of air conditioning or any type of ventilation, we might end up finding that the virus can travel some distances that way. So far, as it stands today, it hasn't been proven that it can be transmitted or that the virus can travel through ducts and then infect someone that is 100 meters away or 100 yards away or even more. So that's the current status.
So we do know that the virus can stay potent on surfaces, metal surfaces, hard surfaces, and can spend some time in the air, but we haven't seen it proven yet that it can be communicated through air ducts and sort of central air conditioning. But you would still advise that the best protection is to social distance, to wash hands frequently, and to clean surfaces that are frequently touched, such as doorknobs, and countertops, and refrigerator doors, and that sort of thing.
Definitely, and not only that, but wearing the mask that you spoke about before, wearing the mask is a double protection. When you have two people wearing a mask, one in front of each other, each one is protecting the other one. It's double protection, and it does protect in many ways. So it's very, very important, the use of masks in public places, no question about it, and also avoid events with crowds, and of course no parties. You can do parties through teleconferencing or whatnot, but not other types. However, I also would warn people about taking medication that you get it advertised in social media, and that you should take this medication prophylactically or this other medication or plenty of remedies. It is proven that the way we stand today, there is no specific treatment other than good hydration and taking Tylenol for the fever and just general measures like those. A lot of studies are going on with medications, but mostly with people that are severely ill with respiratory failures on ventilators, and there are a lot of promising drugs, amongst them mainly antivirals that appear to be working against the virus, but still a little bit of more time is needed to make sure that they're effective and that they might not harm the patient more than benefit.
Well, Doctor, I do think we need to, if you have anything to say about how long you think the stay-at-home order as a medical professional, what you've been hearing about how long the stay-at-home orders are going to stay in place. Do you have anything to say about that?
Yes, definitely. When someone is diagnosed with the disease, but that person might have fever, might have a cough, but might not have the lung function compromised, meaning they don't have difficulty breathing, there's not a big problem, they're not a very high risk people, then the best thing to do is definitely staying at home for 2 weeks. Now, what's very, very, very important is that if it's been proven that that person had the virus, after the 2 weeks, nowadays what we're proclaiming is that people should be retested because they're going to get better, and clinically they should be able to get out of their houses, get out of isolation, after at least 7 days that they were diagnosed with the disease, and after 72 hours that they are symptom-free. No fever without the use of, not using Tylenol and not having fever and feeling well, then in theory they could go out. But that's the time when we need to retest them, because if they still have the virus, they might not be sick, but they might be transmitting the virus to other people. So that's some new information that we have, that after 2 weeks the virus can still be in their throat and they can still transmit it.
Well, Doctor, I do think that that Joel was asking about whether or not, in general, about the stay-at-home order. But let's move on to Sal on the stimulus checks. Go ahead, Sal.
Yeah, I was just wondering if that PPP, is that a one-time thing?
So the PPP, the Paycheck Protection Program, I think you might be referring to the stimulus check of $1,200, because the Paycheck Protection Program is actually something that spans several months. So a business will apply for a loan through the bank, and based on the number of employees they have, and depending on whether they keep their employees employed to the end of the year, they can turn that loan into a grant. It no longer is borrowed money; it's just the money that is being given to them. And in effect, what's happening is people are still being employed; they're not being unemployed. The stimulus check, the $1,200 a month. The $1,200 check, it's not a month, but the $1,200 check that is coming to people. And I think your question is, will that just be a one-time thing, the $1,200 check? The answer is, I don't fully know. It's going to depend on how long the stay-at-home order is going to stay in force and how fast people in our community can go back to work. And I can tell you this, that I think that it's highly likely that we're going to have to consider a second installment if we're putting in another full month, and then another installment if there's another month. And then we're going to have to take a look at, if we come out somewhat, that people have, some part of our workforce is restored, it may be the case that in the fall, that we are going to have to go back into a stay-at-home situation in order to prevent a resurgence of the virus. So until we find an effective treatment for the virus or an effective vaccine, and we know that most of our expectations are being carefully sort of managed in terms of how quickly a vaccine can become available. It's going to be at least a year. If it comes sooner, that's going to be some major medical breakthrough. And at this point, we got to sort of gird ourselves for the long-term, realistic battle we have to fight against this virus. And that means that those of us, that me and Congress and my colleagues, we're going to have to really think about the practicalities of the American people, the practical needs of the American people, and certainly we can't go into a second month of this without also helping the American people out. And if it may require a second installment and a third installment, and so on. So we have Robin from Moreno Valley, who has a question about Social Security. Go ahead, Robin.
Hi. Thank you for taking my phone call. I have actually a two-part question for you. The Social Security checks and Social Security disability, so if you file a tax return, we just file a courtesy return, so do we still have to go online and where it says get my payment, or do we just wait until we get our money deposited when it gets deposited?
I
think hers yesterday.
Okay, that's question number one. Do you have another question?
Well, the question is there a way for you to make the stores, like Brenda was asking about the mask and her concerns about going in stores, and I've had people that I've said, you should have a mask on. There's a $1,000 fine with that. They look at me like I'm stupid, or they go, okay. But it's like in every store you go into, usually there's somebody standing at the door now. Why can't the people standing at the door tell them, no, you're not allowed to come in the store unless you have a mask on? Why can't that be a mandatory thing? Okay, all right. So, Brenda, let me just tell you, it is mandatory. It is a county ordinance. Law enforcement is taking a certain approach, and you might talk to your city council. You might talk to your county supervisor about your concerns. But additionally, I want to give you because they're the ones that are going to transmit public sentiment into an enforcement stance by police departments and by the county sheriff's department. And I think that's one that's my first recommendation, is to speak to your council person or your county supervisor or both. Let them know how strongly you feel about this. Secondly, so let me give you the number again. There is a reporting hotline, and also I think the people here are going to keep track of how many people are calling in, and if there's a strong, I think groundswell of people who want to see more rigorous observation of this county ordinance, which says people need to wear masks when going into public places, that I also think that this is going to create the kind of community pressure for universal mask wearing. The number at the county is 951-351-6866. That's 951-351-6866. And Robin, with regard to your Social Security question, if you've been filing a courtesy return, even though you don't have to file a return, you have a 2019 return or a 2018 return, that should be sufficient. You should be seeing that money show up in your account. If you don't see it, please contact my office, and I'll give you that number. My office number is 951-222-0203. I don't have people answering the phones there, but you can leave a message, and the messages are they're automatically being forwarded to my staff who are working from home. Okay? All right. We have now, is it Neil, who has a question about small business? Neil, go ahead.
Hi, how are you doing?
I'm good.
Just a second. I'm on another call. Let me tell him I'm going to call him right back. Hold on.
Okay. All right.
Hey, Gary, can I give you a call right back? I'm on a conference call. Let me give you a call right back. Okay. Okay, sorry about that. My question...
Conference calls, the story of my life. All right, go ahead.
I've got a little concern. I'm self-employed, a sole proprietor.
Uh-huh.
I don't qualify for unemployment because I'm a sole proprietor, and it's in regards to the payroll protection program and the forgiveness aspect of it. Me being a sole proprietor, they say I qualify, but I am the only employee. Does that qualify?
Well, first of all, go ahead, Sandra, and then I have something to say, but go ahead, Sandra, go ahead. I mean, Claudia. My bad, Claudia. Go ahead.
We just got guidelines on that today. So if you can send me an email, there's a certain way to calculate like what you were earning 2019. So I can send my email and I can announce that right now. So I can send you those guidelines. But it's C Moreno, CMORENO at smallbusinessmajority.org. And Congressman Takano, I don't know if there's anything else you want to add on that.
I do. I wouldn't assume that as a sole proprietor you're not eligible for unemployment, because we've made it possible for independent contractors, people who drive for like Uber or Lyft, who typically would not qualify for unemployment, to get unemployment insurance. So no, I would, or Neil, I would also take a look at whether or not you could qualify for unemployment benefits, and you just need to show that you had income, proving that you had income in the prior year, and it's a little more involved process, but unemployment insurance is quite possibly available to you, in addition to the small business programs that Ms. Moreno described. All right, Angelica from Moreno Valley.
Yes, hello.
Hello.
Hi. I have a lot of questions, but I know we have limited time. The first one, I just wanted to bring to your attention that I've been emailing to contact someone in your office, and I have left a couple of messages, and I have not received any any calls or emails in return. So I don't know how to get a hold of you or ask someone all my other questions. But first of all, my family and I are uninsured.
Okay.
I don't work right now, so I haven't been working because I'm battling an underlying condition. I'm a registered nurse, so I had to stop working for the same reason.
Uh-huh.
So we are uninsured, and my daughter, my 16-year-old daughter, displayed some of the symptoms of COVID, and so her doctor decided to do the testing. They did two testing, but then one of the bills came back to me at $1,208. I'm still waiting for the COVID bill. So how are we going to get assistance if we are uninsured? Like, if we would display symptoms, how can we get tested without, worrying about a huge bill coming in afterwards?
Was that $1,200 bill associated with the testing?
Well, that was one of the testing. They did two testings for her, just to rule out just a flu virus or the COVID. I mean, they both came back negative, but that's one. And they told me when I called my doctor and I contacted the office, they said that they were going to get a hold of Quest and see what they can do, because I still would be getting a bill for the COVID testing.
Well, I can tell you that I believe in the first legislation that we did, is it Angelica or Angelica? I guess you're not online anymore. But we will definitely be in touch with you about your situation. We did make it possible for people not to be charged for COVID-19 testing, and they might have administered other tests to rule out that it was the flu before giving you the other test, but still, and I also want to sort of deal with the situation of the fact that you don't have insurance, and but can you be in touch with my office? I know that if you will, one more time, leave a message at 951-222-0203 and identify yourself, and we will be in touch with you about this being possible casework. So, or also go to Takano.help at mail.house.gov. Takano.help at mail.house.gov. And send us an email, and I will definitely have one of my caseworkers follow up. We have now callers in the queue. I'm getting a note passed to me now. Okay. We have Carl, who has a question related to the Small Business Administration. Carl.
Yes, I had two questions. One question was that you mentioned, or I think Claudia mentioned, that on the Small Business Administration website there was information on how to find lenders for the PPP. I'm on the website and I can't find that, so I was hoping to just get some more specifics on where you would find that information. Secondly,
yes.
Go ahead. Go ahead and ask your second question. Yes.
Okay. I had applied for the online one. Is it the EIDL loan through the Small Business Administration through the online application, but I hadn't heard anything back, and I'm just not sure how to check on the status of that.
Okay, Claudia.
So the first portion. So the Small Business Administration. It's the information that you're looking for, like other lenders that are also accepting the PPP application. That is under our umbrella of our organization, smallbusinessmajority.org. So if you visit our website, you can find that list of lenders that we've been compiling. And I can just give you a quick rundown of a few names right now, if that would be helpful for you.
You may not be on the line. Go ahead,
yeah,
Claudia.
so I'll just say this out loud just so that other people who are listening. So a national funder is called Funding Circle. So check them out. Lendistry is another one that just got approved this week. Centerstone, SunWest Bank, United Business Bank. And those are just a few. It's not listing them all, so I'll note them one more time. Funding Circle, Lendistry, Centerstone, United Business Bank that are here based out of California. So that was the first portion of the question, and then the second portion I forgot what that was.
I think the second question, I must say I got distracted as well, and well, because he was trying to look for on just your website defines the list of the other lenders. So it's smallbusinessmajority.org. And do you remember, Claudia, what it was, the second thing he wanted?
Yes, the status on the EIDL application. I think that's what it was. So so with that, based on what we're hearing from the small business development directors and the SBA, is that there's no form, shape, or form to really know what your status or how long it's going to get feedback. But what we have been hearing is that as of last Wednesday, small businesses are finally getting the approved loan that they submitted. So this is already, the ball is rolling already with that. So that's a good sign. And hopefully if you submitted this 2 weeks ago, you should be hearing back very soon.
All right. Thank you, Claudia, for that. And just as a side note, I mean, so you're telling us that there's no real way to track the status of the SBA loans that people have applied for. Is that right?
That is correct. So there's a number that they get as soon as they submit the application. So definitely have those in file and ready. And then they will notify via email on status or any other things that they have, questions they have for your business.
Okay, but I do want to tell people who may be interested about the $1,200 rebate that there is a way to track that. So it's out at the IRS.gov website, irs.gov/coronavirus. And there should be a tool for you to track the progress of your rebate. Is it Cecily Williams of Moreno Valley?
Yes, that is Cecily. Thank you so much. I had actually was going to follow up on that question. I am a disabled veteran and also a disabled state employee, and I came in when I got the call. You had already given out the address. Is that still just as specific? Is there a specific tab once you go into irs.gov/coronavirus for that actual information for the veterans?
There should be should be a link there that leads you to. Now, tell me, do you file taxes or you don't file taxes?
No, I haven't filed taxes consistently. I worked for a little while, but then my situation got worse, so I filed one time, and I usually don't file. I haven't filed in years, so I don't actually file any.
So you didn't? Did you file in 2019 or 2018? Do you remember?
Ooh, no, I can't really remember. Right.
It sounds. So look, it sounds like it's probably best for you to make sure that you go fill out that form at the irs.gov/coronavirus website, and there's a non-filers page. You should look for it where it says non-filers page on the irs.gov website, /coronavirus. And there should be a simple form for you to fill out, which should expedite that. And if you have trouble, go ahead and give my office a call, or you can also email me at takano.help at mail.house.gov. So takano.help at mail.house.gov, and let us know if you have any trouble. All right, Karen has a question about testing. Go ahead, Karen.
Yes, can you hear me?
Yes, we can.
Oh, thank you, Mr. Takano, for taking our call. There's been a lot of numbers thrown out on all the news channels and everything else about what's going on with this coronavirus. And for the general California area, I know that one country had tested like all their people and found 50% to have corona. So in the general area that we're in, the Riverside, San Bernardino, greater Los Angeles area, if, for example, they tested 100,000 people and we'll say 50% of those people found out to be contagious with the disease or tested positive, how many of those were asymptomatic or had no symptoms whatsoever?
Okay. Go ahead. Doctor, you want to take a crack at this question?
Yes, sure. What has happened over the last 4 or 5 months since December is that depending on the country or on the region, the virus has behaved very differently from one region or from one country to the other country. And it seems that in some of the countries, people live in regions that have not had any access to be tested, and the few that had throw numbers that not necessarily reflect reality. Here in the States, it seems that it depends if you're going to test a random population, meaning a population with and without symptoms, than if you test a population that does have symptoms compatible with the COVID-19 infection. In a way that in our clinics, for example, only like 30% or 35% of the people that are tested come out positive or have come out positive for the coronavirus, whereas in other places it's been only 10 or 15%, but most of those other places are private places where people go and randomly request an authorization from the provider to get tested. So it depends on the population that you take. It is very difficult to calculate the percentage of people that we think are positive with no symptoms. For example, in the Bay Area, there have been people stating that they think, people within healthcare, that they think that up to 40 or 50% of them are going to be positive by next month or so, having maybe 30 or 40% overall not manifesting symptoms. So it varies very, very much according to the type of population, the type of city, if it's a city with a high density population or not. And from that, it depends how easily the virus is jumping from one person to another one and growing exponentially. Also, if you see some of the cities in Europe as compared to some of the cities here in the United States, where we've taken very seriously all the dispositions, including the social distance, the washing hands, the staying home, that now answering Chuck's question also, it's very, very important staying home, and that's one of the main reasons why we've been able in many places to start the flattening of the curve. So all these things bring up all these variations in the percentage of people that have it positive without manifesting symptoms or with symptoms. So I think that we will have to look back in a couple of months and then determine better the real percentage of people that are positive without symptoms.
So, Doctor, if I could follow up here,
sure.
I do have some numbers about Riverside County specifically. Karen, we're nowhere near 100,000 people being tested. I wish that were true, that 100,000 people had already been tested in either county. We have 24,000 tests that have been completed. And of those 24,000 tests, 1,961, or almost 2,000 people have tested positive. So 1,961 people have tested positive out of 24,000 tests, which is less than 10% of people testing positive for the number of people testing. We have 50 deaths in Riverside County, and 376 people who tested positive have recovered. Now, we have to be very careful because often as you test more, you find out that there may be more people positive that you didn't know. And I don't believe that we are testing everybody who could be positive. We're only testing people who meet certain criteria, and that's because of the availability of tests. If there were far more tests, we could have a far clearer picture, and that's why I think, Doctor, we're getting these different sorts of ways in which the virus appears to be behaving, because different countries, different localities have different capacities to be able to actually perform tests.
Yeah, I completely agree with that, and I wish, and I think all of us wish that we could be able to test everyone, just to make sure, due to the fact that there are people with no symptoms carrying the virus. So that's going to be the best solution, and it seems that it might be reachable within a few weeks in order to test everyone so we can see exactly where we're standing and exact percentages of people that have the virus, that have symptoms, and people that have the virus without symptoms.
Yes, and I have heard from the county officials that we have slowed the rate, the doubling rate, and the doubling rate has to do with how quickly our people are being admitted to hospitals or ICU units, and the doubling rate has slowed from 4 days to more like 7 days. So where it was doubling, the rate of hospital admissions was doubling every 3 or 4 days, that's now happening every 7 days, which tells me that the social distancing is beginning to work, and that is an example of flattening the curve. We want to reduce the number of people who have to use hospital beds and intensive care units and not overwhelm our medical system. And when we practice social distancing and stay home, we reduce the chance that we either spread the disease or others may spread the virus to us, and we reduce the incidence of transmission. And so that's the good news, is by as evidence of people actually being admitted to hospitals. That's happening at a slower rate. LaDonna, you are on the line from Moreno Valley.
Hi,
are you still there, LaDonna?
I am here. Thank you. Can you hear me?
I can.
Okay, wonderful. Thank you for offering this up for us to ask questions. I was wondering and hoping that from your level down, is there a way to encourage the local city councils to provide face masks for the homeless population?
That's a concern I can pass on to the county. I can tell you that the county is working hard to provide housing solutions to our veterans. I can tell you that there's been an effort by the county and the state to secure hotel rooms and to help homeless people into better housing conditions. And certainly we should be doing more for those homeless that we can't get off the streets right away, that we need to get them some sort of protection. And of course, the protection is really about, at my level and your level, those of us who aren't healthcare professionals who are directly working with those with coronavirus, that we put on masks to mainly under the assumption that we are reducing the chance that we are spreading the virus, because most of the kind of protections that we're going to wear are not at the N95 mask standard of protection. And so anything less, most things less than N95 masks don't protect you from getting the virus. But when you put on a mask, you're protecting others from getting the virus from you. And it stands to reason if everybody's wearing a mask or some sort of face covering, you're reducing the amount of virus that could be being shed by any one person. And that would stand to reason that we would also encourage homeless folks to wear it if we haven't got them into a hotel or a motel that's being contracted by the county now. So I will definitely pass that concern on. And I want to now call on Marguerite of Moreno Valley. She has a question about testing and Social Security. Marguerite.
Yes.
Go ahead, Marguerite.
Hello?
We can hear you. We can hear you.
Hi. Thank you for answering my question.
You're welcome. Go ahead. You may ask your question.
Oh, okay. My question, I have two questions. The first one was, do Moreno Valley have drive-through testing sites? And if so, how many and where are they? Where are they located?
Okay. And do you have a second question?
And my second question is regarding the stimulus check. If you receive a stimulus check, will Social Security be deducting that earned income for that month?
Okay, so the answer to your question, the second question, is no. The stimulus check is in addition to your Social Security benefit, and it does not get offset. I mean, your Social Security benefit does not get offset. So if you're a Social Security recipient, SSID, you are someone who receives veterans benefits, the stimulus check is in addition to your benefit, and it will not be your benefit will not be offset. So that I'm 100% sure of. Now, there is, Doctor, and I think you can confirm this, in Moreno Valley, there is no drive-through testing available. The drive-through testing is available in Paris, Riverside, and Lake Elsinore, and you can. It's only available by appointment, and they're going to screen you to see if you meet certain criteria for the testing. We don't have at this moment the capacity to test every person who wants it just because they want it. You have to meet certain criteria, and perhaps, Doctor, after I give the number, you can talk about what that testing criteria is. But, Marguerite, the number is 800-945-6766. 800-945-6171. That's 800-945-6171. And this is a number you can call if you think that you ought to be tested, and you can make an appointment through this number, and I'll give it the third time, 800-945-6171. And, Dr. Ratniewski, can you tell us about what sort of protocols are in place for who gets tested?
Sure. They're going to start asking you questions. First ones are going to be if you have a cough, what type of cough, and then if you have a fever, and how high is your fever, and of course if you have difficulty breathing. They will also ask you if you've had contact with anyone that has tested positive or had symptoms very suggestive of COVID-19 infection, and they might also still ask you if you've been traveling to some countries where they have hotspots for this problem, although now that it is a worldwide pandemic, which pandemic is the definition of a worldwide problem. So now that question doesn't have the value that it used to have in the early stages of this pandemic.
All right. Well, thank you, Doctor. And so please, if you think that you are starting to have symptoms of COVID-19, and Dr. Ratniewski just described them, call 800-945-6171. And Darlene of Moreno Valley, you have a question about stimulus checks. Go ahead, Darlene. We can hear you. Darlene, are you there? Darlene. All right. I guess she must have left the queue, and I'll take the next caller, who is Daniel. And Daniel, you'll be our last question, so go ahead, Daniel.
I have two questions. Do you mind?
Go ahead.
Okay, so my first question is, how are we going to reopen the economy when we have only tested 1% of our American population?
Okay, that's good. That's question number one. What's your second question, Daniel?
Now, the second one is, I am a high-functioning autistic, and from my own research, people with autism are hypersensitive. So in the event of a vaccine, how are we going to make sure that the vaccine will be safe for people with autism and that are neurodiverse as well?
Thank you. Very good questions. So let me tackle the second question first. The reason why our expectations are being very, very much tempered by how fast a vaccine will be developed, at least a year. And why? Because of the numerous trials and phases of vaccine development that have to be that are carefully monitored by the Food and Drug Administration, otherwise known as the FDA, and the CDC, the Centers for Disease Control, and also the unit of NIH that Dr. Fauci leads. So it's a very extensive process where they have to look at the safety of any potential vaccine before it is widely available to the public. And I don't have time to sort of go into every single step, but you asked a very important question about making sure that that any vaccine is safe. And Doctor, you might have more to say about how vaccines are developed. And then I want to talk about Daryl's question about when do we open up, given that we've had less than 1% of the population tested. But go ahead, Doctor. Why don't you talk about the safety of vaccines?
Sure. What I can say is that the reason why it will take so long to develop the vaccine is because of all the phases that are included in the proper research when you're going to come up with a new vaccine. Same thing when they came up with the flu vaccine or when they came up with all the other vaccines. It's not only vaccines, but also there are theories that what happens if you transfuse some blood or blood products, including the antibodies, of people that already had the disease. In theory, that might help them fight the disease. However, that's not a safe procedure, and therefore it's not being done. Overseas, where sometimes these phases of research do not take place, and that where they don't have a good regulation for the safety of vaccines and other products, they started working with vaccines that have not resulted in effective treatment. So that is why it's taking some time. The moment we have the vaccine, it will be a vaccine that was already tested from animals to humans according to the proper phases, and that it's a safe-to-use vaccine, definitely.
Well, thank you, Doctor. I just want to comment briefly on Daryl's first question. Daryl, I think you're someone that doesn't sound like you're eager to see us move too fast, and there are others who are eager because they want to get back to work, and there are businessmen that business people that want their businesses to get back in order, and there are people who are worried about making money in order to have enough for retirement, and they're eager to get the economy going. And of course, we have to bow to science and bow to the realities of science, and you are correct that such a tiny number of Americans have been tested. I personally believe that, I think that many health experts would also agree that we need to be able to ramp up our capacity to test far more people, far more quickly. You've heard national health experts talk about being able to test people actually at work, to be able to we don't have enough testing machines and testing capacity to do this yet. We don't have enough tests to actually test everybody who just wants it. We have a careful screening procedure for people who might be showing symptoms, and they have to answer a series of questions. And that has restricted the number of people we have tested. And so, Daniel, I think implicit in your question is, you said, how can we open up the country if less than 1% of us have been tested? The answer is we obviously can't. We can't do that yet. And we're going to have to look at a whole number of indicators in terms of how many people are testing positive. As we are increasing the number of tests, do we see that that the percentage of people testing positive is going down, and there's going to be some very carefully planned ways in which the economy might be ramped up and people can go back to work. I point you to recent news stories about the governors of Washington State, Oregon, and California. All those governors of putting together a plan on a coordinated plan on when they're going to open up. You saw when they will open up their economies again. You're seeing the same sort of planning that are occurring among the governors of the Northeast, New York, Rhode Island, Connecticut, New Jersey, and Massachusetts. They're all sort of making plans. Nobody is saying that we should jump ahead of science, that we're going to have to look to what our health scientists are telling us. So, Daryl, I share your caution, and I also understand the eagerness of people who want to get out of their homes and back to work. But we have to put the health of our community first. This disease, this virus, has no cure, and it is a sure deadly infection for a huge percentage of our our community. So, Doctor, I want to thank you for joining us today. I also want to thank Claudia for joining us today from the Small Business Majority. And I'm going to say that I'm afraid that we've reached the end of our time tonight. I want to thank everyone who has listened or asked questions. And if you are in line to ask a question and we didn't get to you, you'll have a chance to record your question when the call ends. Again, thank you to Ms. Moreno and Dr. Ratniewski for taking part in the discussion, for all you do, and for what your colleagues are doing to help those who are impacted by this virus. There still is no question that this is a challenging time for our nation. People across America have fallen ill, and sadly many have died. In California and other states, those of us who are healthy are being asked to stay home and to stop attending schools, to stop working on jobs, to stop seeing our friends, and in many cases, stop being paid. This physical isolation is hard, and the economic costs of it are real and severe. I want you to know that while you are staying at home to fight the virus, the medical professionals in our community are working every day to help the sick. Your elected representatives in Congress and in the state legislature are doing what we can to provide our doctors, our nurses, and you with the support that you need. So far, California has fared better during this crisis than many other states, and that is because of people like you who are doing your part. Whether that is staying at home, working an essential job, or being on the front lines of our healthcare system. And let me tell you, I am so grateful for the people who work at our supermarkets, the people who are working at our gas station, convenience stores, and the people who are our sanitation workers who are making sure that the trash is hauled away, and all of the maintenance people, the janitors, and the CNAs, the LVNs, as well as all the doctors and nurses and surgeons. You are all heroes. I will continue to work with my colleagues in both parties to identify ways that we can help those impacted by this disease and help those who have lost income or jobs because of the coronavirus recession. I will keep fighting to ensure that our nation's veterans are protected from this disease and that the benefits they have earned are maintained. I will stand strong on behalf of our frontline workers, including those in the United States Post Office, who continue to do the hard jobs needed to keep our nation functioning, even at times when doing so risks their own health. I will keep reaching out to my constituents, to all of you, to hear your concerns and to give you the best, most accurate information I can about the present situation. We are still weeks away from the end of this crisis, but I know that we as a people can overcome this virus and rebound from this. So, as we end tonight, I'm asking you to stay hopeful. I'm asking you to stay safe and to stay home. These are the most important things you can do to help yourself, your family, and our community during this time. And finally, I'm asking you to stay in touch with me at facebook.com/repmarktakano and at takano.house.gov. Thank you all for calling in. Have a good evening. Stay safe, y'all. Good night.